A very warm welcome to you, and thank you so much for joining our Homeopathy 24/7 podcast. We are going to be speaking to an array of international guests who will share their knowledge and experiences of homeopathy with you. We will discuss all types of subjects such as remedies, symptoms, and stories of health. No matter where you are with your homeopathic journey, we aim to inspire you on your quest to natural health and living. The podcast is brought to you by Mary Greensmith, the founder of Homeopathy 24/7, which is a global platform connecting you with a homeopath wherever you are in the world, 24 hours a day. So let's get started with today's chat. Please welcome Mary Greensmith.
Hello everybody, thank you for joining us today. I'm very pleased to welcome Dr. Shrikant Talari. Thank you so much for coming, Shrikant. How are you doing today?
I'm doing good. Thanks for inviting me. I'm very happy to come back.
You're very welcome. Let's talk about homeopathy. Let's talk about personalities. Let's talk about the history. Let's talk about our health journey and what leads us to the symptoms that we have today.
Okay, so what I understand, Mary, is you want me to talk about how past history is important in homeopathy, right?
Yes, yeah, that's right. Why is it that we're always asking this question? Tell me what happened before. Tell me about your health in the past. Why do we need that information?
So let's look around, Mary. What are the diseases that we see today? Majority diseases that we see today, like diabetes or rheumatoid arthritis or hypertension or cancer, or there are so many diseases. And then, most often people come and say that I am okay. I have fairly good lifestyle. Someone else was not so good. Still, I have it. And they are given the answer that maybe this is a genetic factor. Somebody in your family had this. Somebody in the relative might have had this. So you are also going to have this. There is a genetic predisposition. And majority of diseases today we say are because of genetic predisposition. And they give you this answer, but they tell you I have nothing to do to sort of solve this genetic predisposition that you have. All I can do is just wait till your illness develops, and only then I will treat. And this is where homeopathy scores leaps and bounds, because we are able to trace your genetic predisposition, right? So
Okay.
suppose you have a family history of tuberculosis, no, that it seems to run in your family. Then you will see that the patient's father had it, the patient's brothers or sisters have it, the patient's child has it. They are sort of, they can see that there is some kind of respiratory complaint. Some may have asthma, some may have pneumonitis, some may have COVID, and then it seems that others recover from respiratory infections, but we don't recover, and even if we recover, we don't recover fully.
Yes, yes, yes.
Huh? Like that, everybody has a genetic predisposition. And in homeopathy, we are trying to trace the genetic predisposition of the person, and we study the person and his personality, his or her personality. So let's stay, suppose, with tuberculosis now. And then in homeopathy, what is interesting is sometimes you may not even have the symptom of respiratory infection now. Okay, but I can just look at your personality. I can just look at how your eyes are, how your nose is, how your body structure is, how your constitution is, and I know what kind of illnesses you can develop. Okay, if you don't mind, I would like to tell you something. Okay,
Okay, okay.
that that I can see that you majority of your hair is gray. Okay, but there's just one single patch of black hair that you seem to have. So as a homeopath, I'll observe that. I will
Okay.
say, strange hair, you
Mm.
know, why only one patch of black? Either it should be fully gray or fully black or fully blonde. Something as like that is common, but this is uncommon. Yeah.
Yeah,
So
it is so annoying, Shrikant. It is so annoying. I have had this one black streak of hair for over 15 years and it just refuses to go grey.
yes, so that is what we are observing. Now I know that this is a trait of a tubercular personality. A person who has this tubercular trait will have a tendency to develop respiratory complaints. You know, like they will, like in. I think we have discussed once your case, and
Yes, yeah.
I remember telling our audience that you had a injury in your arm, in your legs, no? But the complaint you developed after that was chest complaint.
In my chest. Yes, you're absolutely right. And as a child, I had bronchitis and then later asthma. So I was brought up in a coal mining village where the air was very bad. And none of my sisters or brothers had bronchitis, but I really suffered. So I would definitely say that I definitely have a chest weakness. And you're right, I get a leg injury, and where does it hurt me? In my chest. How bizarre
Yes.
is that?
Yes. So that is what we are looking for. This is why we want to understand your history, your physical constitution, and also what you eat, what you drink, how much you eat. It's no, sometimes people think that, okay, I eat sweet, and doctor told me that if I eat sweet, it's a problem. So I stop eating sweet. Okay, but it is not just sweet that is important for homeopathy, huh? Because your need to eat sweet comes out of a inner compulsion, which comes out of your uh, behavior, your mindset, your personality, etc. So we are not just looking at your desire, what you eat or how you eat, what you drink, but or what, but we are also looking at how, you
Okay.
know. So for example, if you say that, I like sweets, so I will ask you, how much do you like sweets? So you say, I like sweets so much that I will even sort of fall ill by eating this,
Eating
but I
too much.
can't stop. I'm too compulsive. Okay, I have cold and I want to drink water. Everybody says don't drink cold water, but I know I have this compulsion. I have to have my water with ice in it, and only then I feel good.
Yes.
Okay, this peculiarity of how you desire rather than just what you desire is also what we want to understand in the history. That what is it that you eat, and how is it that you eat? What is it that you think, and how is it that you think? You and I both think about homeopathy, but you think differently, I think differently. Subject is same. You are eating sweet, I am eating sweet, but I eat differently, you eat differently.
Yes, yes, you're absolutely right.
Huh.
My problem, Shrikant, is chocolate. And there is a strange particular bit about that as well. Because if somebody were to offer me a chocolate pudding, I would say, I would like that, but would you mind if I keep my slice and I have it in bed with coffee at 6 o'clock in the morning? So I love the chocolate, but I would much rather have it first thing in the morning when I wake up.
Yes. So you see, this is the time modality that we are looking at. So
Okay.
in homeopathy, every single aspect is important. How you eat, when you eat, how much you eat. This whole totality influences what you're going to develop. That is why the history is important. Not just I'm eating sweet, so because
Yeah.
of that I developed diabetes. No, how you ate, what time. This all peculiarities you should narrate to your homeopath. That is when they get to know what remedy you need, not just what. How
Okay.
is much more important.
This is so interesting, Shrikant, because of course, obviously, you've already said that I've got, an odd bit of hair as well, and I've got a weakness in the chest. And also my mum is very tubercular. So that matches that.
What are the symptoms? Why do you say your mother is tubercular?
Why? She always has had a weak chest, and she had pneumonia several times. When she gets flu, she always goes to pneumonia. She just has always, and her personality, she's always moving house. She needs change. She's 82 now, and she just cannot sit down. She always has to be moving, doing something, have a project on. So it's been with her, her whole life. We can see it as homeopaths, but her chest, and she's always clearing her cough, because any medication that she has seems to affect her chest and her esophagus as well. So it's just really interesting that you can see it back through the generations.
Yes. So this is what Hannibal called as miasmatic remedies. So people might have heard that you should take an anti-miasmatic remedy. This is essentially why. Because if you take an anti-miasmatic remedy, then you are stopping the occurrence of such a disease in the future. This is the only science which can actually claim to prevent a disease. So like if you take tuberculinum, if such patients take tuberculinum, then their tendency to have such respiratory infections reduces significantly. To develop pneumonia, this is the best prevention. People say, I will take Covaxin for my COVID. I will say much better if you take this to prevent not just COVID, but all kinds of infections that you can have.
Okay, so just to confirm what you're saying here is that because my mum might have had a tubercular miasm, then I might have inherited a weakness, a predisposition to a lung deficiency. But if I take the miasmatic remedy to help with that, it will help me reduce the possibility of me getting pneumonia or of me having certain conditions later in life.
Correct. Yes, definitely.
Perfect. So just what's interesting as well is that when somebody comes to us, when somebody comes to for a remedy for a particular symptom that's happening now, we might look at that, but by looking at the whole health history, we can see what really needs to be addressed.
Correct. Yes, precisely. So for example, I will tell you that once I saw a very severe case of constipation. Okay, old man, he had constipation. He could pass stool, I think, uh, once in 3-4 days. And even if he passed only little quantity, so he was very troubled. He had taken many prescriptions. He had also met many homeopaths. So when he came to me and he started narrating his complaints, what I observed is he had constipation, and I asked him what is happening because of this. And then he said, then I get restless, then get anxious, I have to walk about, I have to move about. And he was, going on narrating complaints after complaints after complaints. And it was, quite fast pace of, I was finding it difficult to note down. It was very quick. So I just told him, calm down, no, little slower so that I can make note of your symptoms. So then he says, I can't calm down. I have to constantly keep doing things. And if I don't, then I start, you see, then I start become conscious about my breathlessness. And actually, I am breathless if I don't sort of keep myself busy like this. So I gave him a spider remedy, but spider remedies are generally tubercular.
Yes, yes.
They are all tubercular remedies. So I gave him tarantula. His constipation went away. And in the next 3-4 months, the only complaint he was conscious about is now my breathlessness is coming back. Now I'm more conscious. It's not that it was not there. It was there in the background, but he was not conscious of it. And then he said, this I've always had since my childhood, but I thought it was resolved.
Okay.
It was only that he was not conscious. Then he
Yes.
said, now I am feeling this. Then I gave him the same remedy, more potency, repetition, and then the breathlessness is completely gone now. And this is what is important. Till that particular uh, original illness is not treated, is not addressed, you are only going to develop newer diseases in newer locations, maybe newer diagnosis. But this inherent predisposition has to go. Otherwise, temporarily people feel now I am over this respiratory infection. Now let me treat my bowel. Give some remedy for my bowel. Now don't treat my respiration. That's not the homeopathic approach. It always says I want to treat the person as a whole from all angles, from the deepest to the most superficial.
Okay, that's interesting. So what you're saying is that when you do treat, then you effectively take off the top layer so that you're able to see the symptoms that were always there, but were covered up because of everything else going on. So other symptoms become then more prevalent, if you like, or more take up more energy because you've got rid of a whole lot of layers. But that same remedy, that same miasmatic remedy, that same remedy that's addressing your history will help solve the next layer and the next layer and go back further deep into your health.
Correct. Exactly.
Perfect. Isn't it exciting? I mean, how wonderful is it that we've got this form of medicine that can actually be strengthening those weaknesses that we were born with? And as you quite rightly said, there's nothing else out there that can help with this, is there?
Nothing else that can prevent chronic diseases. You may say vaccines are there but they are there to prevent acute.
Yes.
What is there to prevent pneumonia? What is there to prevent diabetes? What is there to prevent a heart infarction? What is there to prevent hypertension? Nothing.
Yeah.
That is where we come in.
Okay, so you did also mention that for a tubercular case, you gave a spider remedy. So what you're saying is that a miasmatic remedy is not necessarily the nosode that you think it might be. It might be a set remedy that has always its backgrounds in that miasm. So each remedy has a miasmatic influence.
Correct. Each remedy tends to have a particular miasm, right? Even though all remedy seems to cover all miasm, but principally each remedy has a miasmatic trait, like every patient has a miasmatic trait, right? So like that, uh, you base your prescription on the miasmatic, but uh, the ultimate selection is based on the symptoms along with the miasm. It's not only miasm. Just because I'm getting respiratory infections does not mean I'll take tuberculinum.
No, it depends on the symptoms that you're suffering right now and how you're suffering from them. That will indicate the remedy that's right for you.
Yes, the combination of miasm and symptoms both have to go hand in hand.
Okay. So as well as obviously the miasmatic influence, that inherited susceptibility, weakness that comes from before birth, of course, you might also then suffer some trauma or grief along the way. Do you often find that clients need to go back and address that trauma in order to clear what is happening?
Yeah. So we started with past history, and the most important part was the genetic aspect. But there are other two aspects that we obviously are going to look for, which is the mental uh, past history, emotions, and stressful situations that the patient has gone through, and also the physical past history, like in what circumstances did you live. Like you said, no, I lived in this circumstance where the air was not good. So we are also looking at that, the circumstances in which you lived, the kind of food you ate, the kind of uh, exposures you had, the kind of maybe toxin exposures or maybe treatments you have had. Those all things come into consideration. So three main things: first is your genetic predisposition. Second is your mental emotional influences. What kind of stress, what kind of sadness, grief, anger, grudge, what are you holding in? What emotions are you holding in? And third is what kind of exposures and what kind of lifestyle have you had. This all these things are taken into consideration when you want to select the remedy. So to sum it up, what I meant is the genetic aspect is the miasmatic aspect, and the symptoms, I said the combination of genetics and symptoms. So the symptoms are your mental symptoms and your physical symptoms, or the physical habits and lifestyle. So that is the symptom aspect, and this is miasmatic aspect. So these two together form our prescription.
Perfect, perfect. So this really explains why your homeopath asks so many questions about what has happened in the past, what has happened with your family, what do they suffer from, but also how you emotionally relate to what is happening to you right now. And obviously, because we all know that, you know, two sisters might be brought up and experience the same trauma, but they act very differently to that trauma. So the way that you act to something, the way that you hold a certain emotion, what you can't, have trouble letting go, is really, really important in order to find the right remedy for you.
Yes, and that is why I think patients should be very open with what has happened, and that's why I think our meetings are also very confidential so that patients can open up and talk about their emotions very clearly. And that really plays a principal role in healing, you know, emotional healing.
That's a really, really good subject, Shrikant. And in fact, what I'm thinking is let's book another session and talk about the emotions and how important talking about emotions is in order to heal, because that is such a good subject. Thank you so much for coming in today. It's been fantastic to talk to you and to have this discussion and, of course, talk about the such important aspects of how to find the right remedy and what we need to consider.
Yes. Thank you, Mary. It was nice talking to you.
Thank you so much, Shrikant, for coming and joining me today and talking about the importance of what we see and the history that's gone before. Next week, I will be speaking to Sunita about just some different cases. We're going through remedies, we're going through cases, we're going through the effect of finding the right remedy and the difference you notice when compared to giving a remedy that's not quite right. So some really, really useful stories, cases that you'll be able to get to know what is important and which symptoms you want to be collecting. I really look forward to seeing you there.
We hope you enjoyed today's episode and look forward to listening to our next one. Please don't forget to follow our podcast on your chosen channel, and please do leave us a review so we can continue to share homeopathy with as many people as possible. If you do have any questions, please do reach out to us on any of our social platforms mentioned in the show notes. We at Homeopathy 24/7 hope to empower you on your natural health journey.